So we're gonna get right into it. So what I'm gonna ask you to do is to take everything out of your hands for just a minute and put both feet on the floor.
Okay.
So if you're a clinician, you know what I'm gonna ask you. To kind of square yourself up in your chair and ground yourself by putting the feet on the floor. If you can't have your back against the back of the chair and your feet on the floor, more important to have your feet on the floor. And just let your hands relax in your lap and go ahead and close your eyes. I want you to take a deep inhaling breath in through your nose and let it go through your mouth. And again, and let it go. And this time I want you on the inhaling breath, draw those shoulders up toward the ears and tense the body. Inhale, shoulders up, tense the body, hold the breath, and this time exhale and drop the shoulders. One more time, inhale, pull the shoulders up, exhale, drop the shoulders. There you go. Lots of heavy things that you deal with on a daily basis, and today was probably not a respite from that. Hopefully the ability to connect with other colleagues has been helpful, because that sense of connection and community and that sense of support that we can give each other is so important. So my work at Kent State University is to, not thankfully on my own, but to keep at the forefront of everything that we do, the health and well-being of every single individual on our campus. That includes students, faculty, and staff. It extends into the community. It extends into the work that we do in the state of Ohio and our connection to higher education across the country. So I want to make sure that you've completed your survey, and I'm going to touch on it, but the reason I want to make sure that you complete the survey is so that you're thinking about the areas that you might need to address for yourself professionally. Because we're turning the tables. We're thinking about ourselves as caregivers. The most important work that I think I've probably ever done in my entire career, I did standing and sitting in nursing stations at the main campus of the Cleveland Clinic. And I had the opportunity to work with caregivers, some of which have been doing their work for 30 years, to understand what it was that they needed during their long shifts. Not only to sustain the body, right, to be really present physically, but also what did they need mentally and emotionally. So for the last 30 years or so, I've been meditating as a part of my own personal practice, and I have spent a lot of time educating myself so that I can go out and help others. And I led groups of caregivers, nurses in particular, to learn how meditation can make a difference in their life. But you cannot meditate your way out of a dysfunctional system. And you all know that. So pay attention to the way that you've answered these questions. In particular, I want you to think about question number 21. Do you feel overwhelmed by your workload? Because it doesn't matter how much healthy food, it doesn't matter how many programs they have for you, if you can't get to any of them because you're overwhelmed by your load of work, then it's not relevant to you. And then also, number 10, feeling trapped by your job. You may have spent all the way through your master's work or perhaps your PhD and work that you find maybe in your 50s, you no longer feel serves you. And no amount of exercise is going to help you with that particular issue. And then number 26, and I love the word that they use, bogged down by the system. That's a little bit of an understatement, isn't it? Bogged down, overwhelmed, stressed out, too much paperwork, all of these things can get in the way. And so we're going to talk about, and we are going to talk about, all the things that we need to do to help ourselves be healthy and happy on a daily basis. But many of you sitting in this room lead teams of people, and you need to remember that some of those things might be influencing your people. And so make sure that you tackle these things first before you encourage them to eat better, or take a meditation class, or go for a walk. Make sure that you are not making things more difficult, and that you raise to those above you those issues first. So when I worked for the Cleveland Clinic, I had an enviable position because I had that robust and large institution behind me, and I would go to talk to large employers, and I would ask them, what do you think is some of the things that most impact the health and well-being of your employees? And the first time I heard it, it was surprising, but after a while I heard it often. They would say, they're too fat. Okay. And then I would dig deeper and say, how long of a commute does your average employee have? And what is your average salary? And let me see your health benefits. And do you have an employee assistance program? And how easy is it for someone to get care in your community? Can they go to a primary care physician and have high quality care? And they didn't have any of those answers. But they now had new questions, because health and well-being is a bigger question than just what we do. We need to look at, are we sitting in the right seat in the right organization? Are our leaders leading us in ways that help us accomplish this job? You can never come to the point where your own health and well-being is sacrificed to help a dysfunctional, bogged down system. And that was the thing that the nurses told me over and over again. I'm so grateful that you got me some healthy snacks in the nurses station. I'm so grateful that if I get 4 people together, you'll bring a yoga instructor and we can do yoga. All of those things are amazing. But I spend 4 out of my 12 hours doing paperwork. And then I have to come in early and do more paperwork. And that changed the dynamic for me about what it means to be healthy and happy, and to have an organization structured in such a way that you can attain those things. We've heard through all the presentations today about all the issues that we face, and you, all of you, know that better than anyone else, much better than I do. And so you need to make sure that first and foremost is something that you're raising your voice collectively over. You can never, and I hear this at Kent State, lots of people know that we have financial things that we're working through ourselves, and they say we need to do more with less. And my answer is, you can't do more with less. You have to tell me what I'm going to cut. What are we going to do without? Because I'm not going to allow my health and well-being and those of our faculty and staff and our students to pay the burden and the price for that. So we'll have to figure out how to simplify. So I'm going to get down off that soapbox for a second. And I'm going to tell you a little bit about my own personal journey, because I'm probably the least formally, academically educated person in this room to talk about self-care, but I have my own personal journey. When I was in my mid-20s, I was diagnosed with cancer, and as part of my own health and well-being plan, in addition to surgery and some other things that I needed to go through, someone put the book, Full Catastrophe Living, in my hands. And that began my journey to the things that I was able to control and bring into my life in a really positive way. So meditation and yoga, that began the journey for me. But also changing my diet, learning to say no, my 2 favorite letters of the alphabet, N-O. saying no to things that were interfering with my health and well-being. But as an adult, my life was transformed on November 9th of 2012. On that day, my best friend, who we're only about a year apart, a mother of 2 boys who she loved more than anything, died by suicide. A shocking, catastrophic event for anyone, but for me, it hit me so hard that it took me 3 years to recover. And during those 3 years, I still struggled with all the things that people in middle age do, right? Your kids grow up and they go to school, you change jobs, you take care of elderly parents. Both my parents passed away. And I had this 30-year track record of really great, healthy habits, kind of this well-worn path that usually I fell right back into. But a lot of those things didn't serve me. But there were 3 things that did. And number 1, and I want to put this right out there because it's obvious, I had privilege. I was a white, middle-class, middle-aged woman with a career and health insurance and financial means and a social structure. I had no ACEs in my background, no suicidal ideation, and mental health issues were only situational in my entire life. So I had privilege. I had all of that. And then I had those habits and those skills that I wasn't doing, but I still had them. I knew them. They were a habit in my life. And third, I had people around me who knew I was in trouble. And even though it was hard to ask for help, they just gave it to me in my face over and over until I accepted. Because just like many of you, I was that person that everybody else came to, right? I was the person who took care of both my parents. I was the person to make sure my kids were launched off into college. I was the go-to person, and so I wasn't going to ask for help. Everybody else had too much on their plate, right? You can all relate to that, can't you? Most of you can, because you're caregivers. At your core, you chose this work because it means something to you, because you are a mission-driven individual, just like nurses, just like caregivers of all stripes, or first responders, or law enforcement. You do this because it matters to you. You don't do it for fame. You don't do it for the money, for sure. You don't do it for the excellent benefits that you get over and over. You do it because you are a mission-driven person. And people who are caregivers and driven by mission are those people who take the least amount of care of themselves. So I want to encourage you, by the time that we're done here, I want you to think of caring for yourself as a moral imperative. That it, first and foremost, your own health and well-being must be addressed. Because otherwise, this bogged down system that is not working for many of us and for many of the people that we serve, you cannot allow yourself to be another victim, another cost of that system. And that's a tough thing to do. But it's the most important thing you can do. Because then the people who think that everything's going along swimmingly will see the cracks in the system, and not at the expense of your own health and well-being. So I bring this up, self-care versus healthcare, because I worked in the healthcare system for 30 years. It was an important part of my career path before coming to Kent State. And thank God we have great tertiary care here in Northeastern Ohio, right? We have the clinic, we have UH, we have SUMA, we have Mercy, we have great care, great access to care. But there's so much that we can do as individuals that can help us to be healthy and happy. And if I can't convince you to do that in its own right, just for your own health and well-being, then I want you to frame it about how it helps and impacts the individuals that you serve. the students that I talk to every day, I guarantee you they know the difference between whether you're taking care of yourself and whether you're not. When you tell them to eat right and to get outside and exercise, and they now see you leave the building until 8 or 9 o'clock at night, and you look exhausted, and you look anxious. It's not a criticism, it's the reality. They know. And when we take care of ourselves, we give everybody else in our life permission to do the same. So we're going to do a brief meditation. And if you've never meditated, I offer you this opportunity to sit quietly and close your eyes. I promise to wake you up if we hear you snoring. So go ahead and put both feet on the floor and straighten your back so that you've got nice airflow, right? It's not about, rigidity. It's just about having an upright spine so that you can have good airflow, good breathing capacity. Go ahead and put your hands in your lap. We're going to meditate for 3 minutes. Take that deep inhaling breath in through your nose and out through your mouth. And then just breathe. Let your breath be natural and even. And see if you can connect with the place in your body where your breath lives. For some of us, we can feel our breath in the rise and the fall of our chest. You might experience the sensations in the back of the throat, or perhaps the tip of the nose. Wherever it is, just allow your attention and your awareness to settle in that place on your body. Almost immediately, you may notice that thoughts come flowing into your mind. And that's good because that's what our minds and our brains are for, to think. We're not trying to stop our thoughts. We're just trying to give our thoughts something else to focus on. So allow the thoughts to go and bring your awareness back to where you see and feel your breath living in your body. Gently begin to deepen your breathing with your eyes still closed. Gently begin to move your fingers and your toes. And when you feel ready, go ahead and open your eyes and give yourself a nice long stretch. From fingertips to toes. So that was about 3 minutes. It was actually 2 minutes and 50 seconds from the time I started talking and asked you to deepen your breath. How many thought that lasted at least 20 minutes and you were afraid I'd fallen asleep? Okay. And how many of you were just getting into a good place and you're like, oh, I could do this for a little while longer? All right, good. Okay. So it's usually somewhere between the two. So if you haven't added meditation to your practice, in some way, shape, or form, both for yourself or for those that you serve, I encourage you to at least investigate it. It may not be the right time. You may need to find a couple of different teachers, but meditation and a sense of mindfulness is really helpful at reducing anxiety, mild depression, improving sleep. It improves working memory capacity. We're actually in the midst of 2 long-term research studies at the Cleveland Clinic, Kent State, actually, in connection with Cleveland Clinic, to show that it improves working memory capacity, so that ability to recall lots of pieces of information in a critical moment. So that's just one. And if you haven't tried it and that was your first opportunity, hopefully you'll try again. So these are the 6 best doctors. And this is my favorite, right? So this is 2,000 years old. This is from a Buddhist text, translated pretty closely from Sanskrit and shortened into sunshine, water, rest, air, exercise, and diet. So I'm a simple person, and I like simple, straightforward things. And when life gets tough, I refer back to my 6 doctors. And I make sure that I go through the protocol that I know works for me. And over time, it's changed. For each person, it's different. So for exercise, it could just say physical activity or movement. Maybe it's going for a walk. Maybe it's going for a bike ride. Maybe it's going out into the garden or walking your dog, playing with your kids on the playground. It's movement. It's getting physical. It can be helpful. You may have folks that you're working with high anxiety, and that's not unusual. You may be experiencing, when you're working with them, an even heightened level anxiety. It can be helpful to spend some time moving with that person, going for a walk, walking around the small room, whatever the case may be. I love sunshine. We have all these students, and then by February, they are all so pale, right? They just, especially if they're not from Northeastern Ohio, they're almost panting from the lack of sunshine, right? Dr. Pam's shaking her head, she knows, right? By February or March. But the thing is that if you can get outside, even on the most overcast day, and I learned that the Ravenna Arsenal is not located here because of our high cloud cover, right? Thank you, Kurt, from Leadership Portage County. But the fact is that we still have really, really dense cloud cover. But when you get outside, research shows that you still activate vitamin D no matter how thick the clouds are, because the sun is still on the other side of them. And you still get something from it. And so getting outside and moving is the #1 thing that I tell the students. Walk down to the city, go down to the river, walk the Esplanade. And the same goes for all of us. Put on a hat, put on some comfy shoes, put on some long johns underneath your clothes, because it's going to be really cold according to the Farmer's Almanac this winter, and get outside. Research shows that almost all mental health conditions and illnesses are improved by being outside. There's a long-term study going on in Japan about a process called forest bathing. They live in a very tightly packed island nation, and the rates of suicidal ideation, depression, and anxiety are extraordinarily high. So beginning about 7 years ago, they started taking large bus loads of hundreds and hundreds of people and taking them out into their beautiful verdant forests. and getting them out, doing some very simple biological tests on them at the beginning, and then taking them on a 20-minute walk. They don't even say anything. It's not like they're educating them on the plants or the flora or even the science behind why they're doing it. They just get them to walk. And then they check their blood pressure and their cortisol levels and all kinds of other things at the end. And it's astonishing. And then they follow them 24 hours later, and it's still astonishing. So get outside and get some movement. It's the number one thing I tell the students. And then we, of course, have water. If you go 36 hours without drinking a significant amount of water, your brain will actually shrink in size. You know this. We know this, but we forget because we have 9 patients that we need to see in a row. And you have 3 more meetings you need to get to. And you have to finish a PowerPoint presentation like I did this morning and raise Karen's anxiety level. Because I only had time to finish it this morning, between 5 and 8 a.m. So get yourself some water. Hydrate. When you're feeling cranky, or you're working with someone who's cranky, get them some water. Go for a walk outside. There's 3 of the doctors all put together. Get some fresh air. There's the doctor number 4. So the breathing exercise of focusing on our breath is so important. You know that. People come into your office or sit across from you who need services, and they're breathing way up here in their throat. They're filled with anxiety. And if you yourself are not focused, and you're not breathing from your belly, from your abdomen, that deep diaphragmatic breathing, they're going to pull you up into your throat instead of you drawing them down into their belly. So that's another reason to take care of yourself. Because you model and you show that behavior to the people that you're with, the people that you work with, the clients that you serve, the students that you see, the patients who depend on you. Make sure that you yourself are really focused in your breath. I had an opportunity to work on a visual film for our psychology department, counseling department. And I was the patient, working with the therapist, modeling that breathing. And we had to do 4 takes because I just automatically get into that place. And they're like, no, you're supposed to be breathing up in your throat. I was like, okay, I can do that, I really can. And so they gave me this scenario that I was working through, and of course I was right up here. They told me something terrible had happened to one of my children. So make sure that you yourself already have that doctor invested, which is that deep diaphragmatic breathing. And diet. So the number one thing I tell the students, if it makes a crinkling noise before it passes over your lips, sorry about the snack you just had. At best, it's entertainment, but it's definitely not improving your mood. It's not lowering your anxiety. It's not improving your sleep. It's not doing you any good. And I would love to convince all of you about why you should eat a plant-based diet, but just do your best to eat a healthy meal that your great or your grandparents would look at and identify as food, right? They may not know the fancy arugula and French radicchio that we have on our plates, but they recognize it as a green, right? So start out with the plants and then put your entertainment on top of those plants. It makes a huge difference in your mental state and your resiliency. And because I think I can improve on the Buddhist tradition, no ego involved there, I add love, laughter, and hugs. And I changed the hugs to be connection. And that's what today is about, right? All these people, perhaps coworkers that you're with, or folks that you know from lots of the work that you've been doing in this community, we are each other's support. I see some of my coworkers and I know that I can go to them and talk to them about things that are happening, that are stressful and difficult. You need to have that support. You need it at home, you need it at work, And if you don't have it, you better figure out a way to get it. One of them can be to be that person that raises the issue in your own office, whatever it might be, to create opportunities for trust to build. Because trust is the most important foundational thing that we have with connection. And if you're not nurturing those relationships outside of work, and I mean in family, I want to take you to a moment that will remind us all about what it's about. I had what has turned out to be the good fortune and blessing to be at the bedside of people taking their last breath. And I can tell you that the things that people talk about have nothing to do with their job. It's all about the people they loved, the difference they made, the things that really matter at their core. And if you really think about what stresses us out, and I mean beyond the day-to-day stress of work, it's when we realize that the way that we spend our day is not in alignment with the things that truly matter to us. And if we're not actually looking at our lives and figuring out what matters to us, then we better get to it. And so I passed around a 2-page form that if you want to pass it around to those, we're not going to do the exercise now. I encourage you to do it at your leisure. We don't have time to do it. We've already done the compassion fatigue, and I don't want to fatigue you with something else. But it's a way to think about how we spend our day. We have 168 hours in a week. I think I have that right. 168 hours in a week, 1,440 minutes in a day. We need to make sure that the majority of that time is spent on things that matter. So it's not your handheld computer, because I can assure you that that is not going to be your smartphone. It's not going to be with you at your deathbed. Right? That's not what we want to have there. We want our people that we love and that we care about surrounding us. One of my closest friends is in an a cappella group, and they sing people to the other side. They sing to people in their last moments on earth or close to the end. And she shared with me those videos. And those are powerful, because to them, that's what mattered. Song, connection, people around you that love you. And if we don't think in terms of the end, we don't spend the middle part doing the right things. We're anxious and stressed and depressed and sad and angry and frustrated and annoyed because we're not doing the right things. So creating that sense of alignment can be difficult. Over those 3 years after my best friend's death, my SSR score, the stress-related score, was over 300 for 3 years in a row. And if anybody knows, that's like the highest you can have. But I had that well-worn path, those habits that served me. I had privilege, which I had unearned to some degree, but had, and I took advantage of it. And third, I had people to, even when I didn't want to take their hand, shoved me from behind toward doing the right things to help me, so that I didn't add up to the cost of all the things that had happened to me. And so I've spent the last 4 years since I came through that really dark and difficult time and realigned my life. I had an opportunity to go back to the Cleveland Clinic, which was a place I loved and I adored working, but I worked 65 hours a week, and I missed some of my kids' birthdays. And I missed lots and lots of things that were important to me, and my friendships suffered as a result. And so I slimmed down my life, and I found an opportunity to come to work at Kent State, where I can walk to work. And I got my first dog at the age of 55. And I have 6 little chicks who I adore, even though I'm a vegan and don't eat their eggs. And I take those eggs and I give them to the campus kitchen. And my life is rich in ways that I could never have had from the money that I made at the Cleveland Clinic. Instead, I'm hunkered down in a team that really wants to improve the life and welfare of the whole community. And that's what you want. That's what we all want. And so make sure that what you do and how you spend your time is aligned with what matters to you. Sit down, write it out, think it through, align with your partners, align with your children, align with your friends, align with your coworkers. Because you don't want to be that person at the end of their life who didn't do those things, whose eyes opened in the last few moments of life and said, oh, I missed the boat. I missed it all. That's why I've been so stressed. That's what I missed. I lived somebody else's life and not my own. So you can eat all the great food. You can get physical activity, but make sure that the way you're spending your time and what truly matters to you at your core is aligned. And then you can withstand the trials, the tribulations, and the difficulties of a bogged down system, of budget cuts, of increases in suicidal ideation, of higher rates of poverty. Because the whole system and all those people out there who don't have privilege and don't have resources and don't have education and don't have a support structure, if you can't help them, then they're really, really going to be at a loss. So I hope that in this few minutes we've had together, I've been able to maybe change your thought process. So think about one thing that you could do between now and when you go to bed tonight that nourishes you, that fills you up, that adds to your own resilience, and make a promise to yourself that you're going to do it between now and when you go to sleep tonight, whatever it is. Call someone you love, eat something nourishing, go for a walk outside, it's not raining. Whatever it is, take care of yourself, take care of each other, and thank you.